For Civic Center TV, I'm Emmy Lucas here at the Henry Ford Hospital in West Bloomfield, where the 2013 Greater West Bloomfield Chamber of Commerce Leadership Luncheon is about to take place. Behind me is this wonderful audience with an amazing program scheduled, so let's get things started.
Good afternoon, everyone. Welcome to the West Bloomfield Chamber of Commerce 2013 Leadership Luncheon. My name is Kelly Taylor. I'm the current West Bloomfield Chamber of Commerce president. I'd like to start this afternoon with a quote by author John C. Maxwell. "A leader is one who knows the way, goes the way, and also shows the way." I'm sure that those of you in the attendance today that know our guest of honor, Nancy Schlichting, would all agree that Nancy does in fact do all three of those things that I have just mentioned. I'm delighted to be here today at the Henry Ford West Bloomfield Hospital. I'm even more excited to hear Nancy's story, as I've heard rave reviews already, so I cannot wait. We are very honored to have such an excellent example of leadership right here in our West Bloomfield community. Nancy, if I could just borrow you for just a second, I'd like to present you with a bouquet of flowers on behalf of the West Bloomfield Chamber of Commerce and also English Gardens.
Thank you so much.
Thank you for being here. I'd also like to take a moment before we begin to acknowledge some of the other leaders from our community that are in attendance today. We have with us West Bloomfield Township Supervisor Michelle Economo-Uresti, West Bloomfield Township Clerk Kathy Shaughnessy, West Bloomfield Township Treasurer Terry Weingarten, West Bloomfield Chief of Police Chief Patton, West Bloomfield School District Superintendent Dr. Hill. I would also like to thank our sponsors of today's event who, thanks to you, were able to put on such a wonderful event. If I could just honor American House Senior Living Communities, Comcast Business Class, Henry Ford West Bloomfield Hospital, Orchard Mall, Motion Realty, D-Business Magazine, and also Civic Center TV. I have one final announcement before we begin. You'll notice that we've left some index cards on the table. We're going to be holding a question and answer session at the end of the lunch. If you could fill out your question on the card, we'll come around and collect them, and then we'll answer as many questions as we can from the podium. So without further ado, I would like to introduce our special guest and Master of Ceremonies for today, Dr. Frank McGeorge. Dr. Frank McGeorge can be seen on WDIV Local 4 News with his informative good health reports. And when he's not helping to educate people on medical issues, he is helping to save lives in the emergency room at Henry Ford in Detroit. He is the past president of the Michigan chapter of the American College of Emergency Physicians, a member of the board of directors of the Red Cross, and a former board member of Haven, Oakland County's Center for the Prevention and Treatment of Domestic Violence and Sexual Assault. Dr. McGeorge's many honors over the years include several Emmy Awards, Associated Press Awards for Journalism, a Michigan Association of Broadcasters Award, and the Michigan State Medical Society Award for Excellence in Healthcare Reporting. Please help me to welcome Dr. Frank McGeorge.
All right, so I'm going to try and be brief and move things along so that we don't overrun our time. I was asked to say a few words about leadership in the various roles that I've held, from ER doctor to professional society president to board member to residency director, reporter, dad, you name it, all kinds of things. They're all very different, but they all have a common thread. It's moving in a direction that I commit to and that I feel passionately about. And I think that's ultimately what's made me successful. Believing in what I'm doing and then collaborating to get it done. And I say collaborating because to me, leadership actually requires collaboration. The more we listen and remain open, the more we can really inspire innovation and ideas in the people around us. And I think that's an essential element. But I will say being a leader also requires the courage and the personal conviction to make that final call, because after all, democracy only goes so far, and you do need a leader at the end of the day. But I do want to draw a distinction between being a leader and being a boss. I've held both in some respects in different spheres, but to me, a leader is someone that people want to follow. A boss is someone that they have to follow. You want to be a leader. Getting people to want to follow you or want to believe in you and listen to you actually means, to me, inspiring people to believe in your competence and your character. So I'll begin by making the less than inspiring admission that I am a flawed person. But I think we all are. And this doesn't really prevent us from being good leaders. In fact, I would believe that having insight into our own frailties helps us better understand and really accept all of the people that we work with. And I think it also helps you be honest with others and really be true to your real values. Now, when it comes to competence, often I've actually found myself in charge, and many of you have, of teams of people with varying levels of experience and expertise. And in some cases, they may actually have more experience and expertise than mine. But that doesn't make me less qualified either. Ultimately, to be a good leader in my mind, I don't think you have to be the smartest guy in the room. But you do have to know enough to make good decisions, exercise sound judgment, and really have good intentions with clear values that are consistent and high standards. I think with all of that, you might have a winning combination. So going back to my life, as an ER doctor, for example, when I'm working, I am, in fact, I guess, the captain of the ship. But one thing that we know from parallel industries, for example, the airline industry, is that everyone's input is important. This goes with crew resource management as kind of the buzzword. All of that is important for setting safety standards, for efficiency, for allowing people to have camaraderie. So even though I might be the leader, I want the people around me, and really I need the people around me to give their input and to help me make everyone's job better and safer ultimately. So what about leadership in my role as TV guy, I suppose? Well, I guess it's a little bit different. As TV guy, there's a huge element of self-confidence. Obviously, you have to be able to just put yourself out there. There's the willingness to accept feedback and be self-critical, and I think all leaders need to have a certain amount of self-criticism and be self-critical to a certain degree. You don't want to be paralyzed by it, but you do have to have some insight into, again, what you may or may not be doing right. And then there's also a certain amount of drive and motivation, self-starterness, to tell compelling stories, in my case, that will motivate other people to change their health. And in my opinion, that would be leading by example in many cases. You don't necessarily want to preach and then not do, so I try and do the healthy things that I recommend to people. So the one thing that I really, I guess, want to leave everybody with, to me, being a leader isn't something that is granted by your title. Being a true leader is a position that's earned by trust, collaboration, and competence. And I think with all those things, you have a winning combination. And now it is my pleasure to introduce Dan Delamora. He is the Senior Manager of Business Services for Comcast and a proud sponsor of this event. And so, Dan, I'd like you to come on up and say a few words.
Thank you, Doctor. Thank you, Doctor. Good afternoon, everybody. Welcome. I'm Dan Delamora. I'm the Senior Manager for Comcast Business Services, and I'm very happy to be here this afternoon. Before we get started, I would like to thank and give a special thank you, actually, to Suzanne Levine and the West Bloomfield Chamber. They've been wonderful. We have a really terrific partnership, and we look forward to many more events and working together and networking in the future. I'd also like to thank Henry Ford Health Systems for having us. This facility is amazing. I had no idea that a hospital could look this good. At Comcast Business, we provide solutions, communication solutions, to small and medium businesses like yourselves. I'm very happy to say that we bring on at least somewhere around 1,200 new businesses every single month. We offer solutions for small and medium businesses and large businesses. As technology is vital to the success of our products, it helps businesses afford and leverage technology to compete on a larger scale. Comcast is committed to the business community and continues to launch new technologies to enhance efficiencies as well as supporting the local economy. Our partnership with the West Bloomfield Chamber is important to us, and we support their mission because when the business community succeeds, our state succeeds. As a partner, we offer discounts on services to chamber members, and we give back to the chamber. Please feel free to see myself or my constituents. Liz Ramseur handles small and medium businesses. Liz? We also have Justin Williams, who handles our enterprise and advanced applications. And as a member of the West Bloomfield Chamber, you're able to receive free analysis of your bills and your communication. I'd like to acknowledge one of our community investment initiatives. It's called Internet Essentials, and it's a low-cost internet program for children that receive free or reduced lunches through their school lunch program. It's really a wonderful program. Comcast has been able to help bridge the digital divide in our state with thousands of disadvantaged families, and they're now able to share the cost of internet at no charge to them at all. So I would like to thank you for your time this afternoon. We look forward to hearing from our guest speakers, and we look forward to seeing you at the West Bloomfield Grub Crawl on October 3rd. Thank you very much.
Thanks so much, Dan. Okay, well, you guys can have lunch, and I won't be bothering you until 12:30-ish. Is that right? 1 o'clock. 1 o'clock. I apologize. Enjoy your lunch.
And now one of the main contributors and planners to this program here today, Cecilia Fydrosky. She is the director of the medical group here at Henry Ford Hospital. What was your role in planning this here today?
Well, actually, when the idea came for the leadership luncheon, I suggested that our CEO, Nancy Schlichting, be the speaker because of her wonderful leadership here in the health system in Michigan and across the country. And she's actually just a wonderful leader and has a really great story to tell.
And this is your home base as far as your work is concerned, correct?
Yes, I oversee the outpatient clinics here at West Bloomfield Hospital. So we have the hospital and we have specialty clinics here at this site.
How important is it to bring events like this to the community and invite them here today?
It's absolutely very, very important. It's wonderful to be a member of the chamber, and it's also a wonderful way for businesses to showcase their business. We have a beautiful hospital here. It's a beautiful site, and we want the community to see it. And our former CEO, his philosophy was he wanted this to be a place where the community came when they were well, not just when they were sick.
Another very important speaker here today is Dr. Frank McGeorge, WDIV reporter and ER physician here at Henry Ford.
That's exactly right, yes.
Now tell me, what are some of the parallels between your career as a member of the media as well as the ER physician?
Well, it's kind of interesting. In many ways, they're very much the same. In the emergency department, we have to adapt to changing circumstances. In the newsroom, it's the same thing. There's breaking news. Things are always changing. You have to think of things on the fly. So there's a lot of similarities, but some of the obvious differences. In the emergency department, it's all life and death. On the news, it's just talking about life and death.
Now, coming to a leadership luncheon here today, what do you hope to express to the audience as far as being a leader in the community, not only as a member of the media, but as an important member of the Henry Ford system?
Well, I think part of it is understanding that leadership involves bringing trust and compassion and collaboration to any relationship. Leaders are not bosses. Leaders are people that inspire other people to follow them. And to lead by example is something that is very important. So I think that's really what I want to convey. And I think that's an important aspect for everyone to remember in every aspect of their life. Even, when it comes down to being a dad, you have to lead by example. You have to encourage your children to want to follow you. That's not to say your employees are your children, but in many ways, those things all carry over. Compassion, encouraging trust, and really forming collaborations.
One last question. Who inspires you?
Boy, that's really interesting. My mother, actually, and my mother died a number of years ago, but, a day does not go by that I don't think of my mom. And one thing she always told me was, if you're not moving forward, you're moving backward.
And now the keynote speaker for the entire program, CEO of the Henry Ford Health System, Nancy Schlichting. Thank you so much, Nancy, for being here today.
Oh, it's great to be here, Emmy. Thank you.
What do you hope the audience gets out of your speech here?
Well, I hope to tell the story of Henry Ford Health System, about great innovation, almost 100 years in history, and always being relentless in our pursuit of doing the right thing for our community.
And not only does Henry Ford have a wonderful story, but you do as well. As a woman in the leadership role, what do you hope to express to the audience in that regard?
Well, I was very fortunate. I was raised by parents that told me I could do anything. So, I feel like the lucky one. I've had amazing opportunities in my career. I've worked with incredible people, and it is all about people. So, my story is about leading great people and having wonderful opportunities.
Because programs like the Leadership Luncheon are so important to the community, they leave it up to the pro. Joining me now is the Executive Director for the Chamber of Commerce, Suzanne Levine. Suzanne, why bring the Leadership Luncheon to West Bloomfield, and why is it so important to show it to the community?
I think it's really important to show that we have these exemplary partners, especially with Henry Ford West Bloomfield Hospital, and to bring someone of Nancy Schlichting's stature to the community and have them hear her leadership story, I think is inspiring.
Now, not only do you have Nancy Schlichting, but you have a really nice lineup for these attendees to listen to today. Who else do you have?
We are very honored and privileged to have Dr. Frank McGeorge, who is not only a Henry Ford emergency room specialist, but he's a WDIV medical reporter. And so we're so excited he's the MC for the event, and it adds a little bit more cachet. And of course, it ties into the whole health leadership topic.
How important is it to show leadership to the community, especially during the rough times that everybody's had in the last couple years?
I think what's so inspirational about Nancy's story is not only is she a woman, but she's been named in a lot of different magazines as one of the top 100 health professionals. And so I think it's really important for other people to understand that leadership is more than just saying, I'm the chief. It's leading by example, and she has done a phenomenal job of doing that.
Well, now that you've all had lunch and you're hopefully having a little coffee, I'm going to ask you to take your seats. Please, pretty please, with sugar. So it's my pleasure to introduce Nancy Schlichting, who is my leader and not my boss, to give what I think will be an inspiring and hopefully very educational talk on her perspective on leadership. More than anything, I am really interested in hearing this because there are also question and answer sessions afterward. If you have any questions that you want to ask Nancy, please write them down on one of the cards at your table and pass them to one of the people who will be around, or I'll be around, and we'll have little time for question and answer afterward. But please, without further ado, I'd like to welcome Nancy Schlichting. Thank you so much.
Thank you so much, Frank. Is this on? Can you hear me? Okay. Can you hear me now? It sounds like a commercial. Is it on? Yeah. Okay, great. Well, thank you, Frank, and we're honored to have Frank as a member of our team at Henry Ford Health System because, as I think all of you know, he is a remarkable talent, not only helping us all know how to take better care of ourselves, but frankly, he's a tremendous ER physician and member of our Henry Ford Medical Group. So thank you, Frank. It's such an honor to be here and a particular pleasure to be in our place here at Henry Ford West Bloomfield. And I always appreciate the importance of the chambers of commerce in our region. I had the great privilege this past year to chair the Detroit Regional Chamber and learned firsthand how important it is that we work together, collaborate, as Frank said, in terms of the business community and really furthering the economic development of our region, our city, our state, Extremely important work, so thank you for the opportunity to be here today. I do have to tell you a secret, though. The reason I'm here today is because there's a woman that asked me to be here, who I cannot say no to. And that is Cecilia Fedrowski, who is one of our great leaders at Henry Ford. Cecilia not only is a manager here at West Bloomfield, a director, but she has been a fantastic leader in our system for many, many years. And we are so grateful we are grateful for your leadership. And she could give this talk as well as I could about how we lead and how we hopefully really bring innovation and new ideas, new thinking into the healthcare space. I also want to mention that, despite the fact we built this hospital just about 5 to 6 years ago now, we have been in West Bloomfield for almost 40 years. We have 160 acres of land that encompass this area from 14 mile to 15 mile. We have grown an ambulatory site over that period of time. The West Bloomfield ambulatory site was one of the most revolutionary in the United States. It was a comprehensive outpatient setting in the 70s that just didn't exist in very many places. In fact, I came to see these ambulatory sites in 1979 when I was a fellow at the American Hospital Association. So it's very interesting that I'm actually here today after all these years, and that the person I worked for at the American Hospital Association, Gail Warden, was my predecessor here as CEO of the Henry Ford Health System. So you can see that the world is a circular place, and you are always nice to people throughout your career because you never know where you're going to end up. The other thing that makes me so proud of our work here in West Bloomfield is that for a long time, West Bloomfield has been a place for us that has been kind of a laboratory of innovation. And it's been a great environment to do that. The community has embraced that. I think our staff, all of our leaders, have really tried to make this something very different. And it has inspired us in many ways, and I'll talk a bit about that today. And I will also say that the partnership with the community has been an important part of that special sauce that makes this work, because really we learn from all of you who are in business, who are members of the community. The diversity of this community has been a great strength for us, and we've really appreciated the opportunities to do that, because the input that we received from members of the community, including our patients, business people, our civic leaders, the police department, fire, everyone, really helped shape how we designed this hospital. And so all of you can take credit for it. So if you're driving by and you're with your children or grandchildren, you can say, that's the hospital that I built. Because we were all a part of it, and that's what makes it really quite successful. The reason I'm here today, though, as a leader, is because I get to work with the most remarkable organization, I think, in healthcare today, the Henry Ford Health System. Just to give you an idea of how we are different, perhaps, from the norm. Over the last 10 years, Henry Ford Health System has more than doubled its revenue, been profitable every year, despite dramatic growth in uncompensated care, has won all of the top healthcare quality awards in the United States, including the Baldrige Award, and now, really has the opportunity to help shape the future of healthcare as we are going through one of the most dynamic, if not the most dynamic time in healthcare in 50 years. So the model that was crafted many years ago, actually started by Henry Ford himself, has been the foundation for an organization to continue to grow and evolve and change over almost 100 years. And for someone like me, who started my career at the American Hospital Association and almost 40 years ago now, had a chance to meet with Wilbur Cohen, who was at that time the Secretary of Health, Education, and Welfare, and is described as the architect of Medicare and Medicaid. And the chance to meet him was kind of prophetic for me, because he said to me at that time, he said, Nancy, someday you will help shape health policy in this country. And I feel like my role here at Henry Ford Health System is that opportunity, that we have a chance because we can influence, we have a voice, we have input, we sit at the right tables, we have leaders that sit on so many boards across the country in their professional organizations and other civic organizations to really make a difference. And I just make a few comments. I'm sure I'll have questions about this at the end. But one of the things that that I think we have to have some patience about is allowing the changes to take place and recognize that in our own organizations, when we have major system change, it takes time. It takes time to get it right. It takes time to implement, and that's what we're going to be going through over the next several years in healthcare. So I think it's going to be very important to have input and continue to evolve and change and improve what we're doing. I'm asked often, though, how did this happen in an organization based in Detroit, Michigan? I get that from a lot of people around the country, even in our own backyard. And the reason I think we've been successful as an organization is that we have constantly focused on strategy, leadership, and culture. And to me, that's really what it's about. Obviously, strategy is critical, and one of the things that we try to do at Henry Ford is have a relentless focus on the fundamentals. We can do a lot of exciting and interesting things, but if we don't get the fundamentals right, there's no way that people have confidence in us in the other things that we try to do. And our fundamentals are defined by our 7 pillars of performance. And the first one is people. Then we talk about quality and patient safety, service, growth, academics, community, and finance. And it's not by happenstance that people is first and finance is last. Because we believe if we do all of the other things really, really well, the financials will take care of themselves. And frankly, we want to make decisions based on our people and the people we serve, on the quality and safety we can provide, and the extraordinary service that we can provide to patients and families. We also want to think big. One of the things with strategy is that sometimes people say, well, we have a strategic plan. It's sitting over here. I get it out periodically. I look at it. That's not strategy in my book. Strategy is a very dynamic process, and you have to think strategically all the time. My goal is to have 23,000 strategic planners at Henry Ford, that everyone is thinking strategically about the work that they do. And when you have, a strategy that is that dynamic, it allows you to think big. It allows you to be a little crazy at times, which is kind of fun. It allows us to set ambitious goals and hopefully create an environment in the organization where it's okay to do that, because nobody gets in big trouble if we don't achieve that crazy goal. But if we come close, we're far better off than setting that small goal that we achieved. So it really is, how we think and how we set even goals of perfection. We have a patient safety program at Henry Ford called No Harm. And we mean no harm. We think that our goal should be absolutely no harm to patients that come within our organization. And as you know today, care is very complicated. It's very difficult to achieve that. But we are relentless in our pursuit of no harm. We also set a goal that we were going to go after the Baldrige Award, which is the award given by the Secretary of Commerce for absolute superb excellence in quality by all types of organizations. We set the goal we were going to do it as a health system, not as an individual hospital. And the reason we did that is that, in essence, the reason I wanted us to get into the Baldrige program was to better integrate what we do across our business units. And if we set the goal to have one business unit win it, wouldn't that have been terrible? Because everyone would have said, well, I wanted to win the Baldrige Award too. Why is it just them? A health system's a lot like a family. Those business units are like siblings. And nobody wants to be the one person, that gets all the attention. So in fact, doing that as a system was the hardest possible thing we could have done. In fact, in my quiet moments, I wasn't sure it was possible, but I didn't tell anyone that. And I just finally, one day, I've told this story a few times, we had been applying and applying and applying. We worked on this for 7 years. We applied 5 times. And after about the 3rd time, when we didn't get a site visit, people kind of said, maybe we should just not do this. Of course, I said, no, absolutely not. This is improving us. We're getting better every year. We've got to keep going. But finally, I had always said, oh, it's just about the process. If we don't win, it's okay. Finally, I said, damn it, we're going to win this thing. And you know what happened? The next year, we won it. We had 1 site visit, and we had an amazing experience. 1,200 people throughout the health system participated in that site visit. They did not want to talk to me. They wanted to talk to everyone. So everyone won that award, and what a great moment that was for us. The other thing that I think is interesting is that, you know, again, thinking big, we believe we can grow in a declining market. And Detroit, as you know, has lost a lot of population. We've gone from, in the 10 years, we've gone from about a million people down to about 700,000. I remember when I came, you know, everyone was saying, well, you know, you can't grow in Detroit. And I ran Henry Ford Hospital for 2 years before I became CEO of the health system, and I basically found out what an incredible jewel that organization was. But it had been underinvested in, underappreciated, and frankly, you know, they kind of got away with a lot of excuses. Well, you know, we're in the inner city. You know, service maybe can't be as good as the suburbs. I said, are you kidding? It won't be as good if it's not clean, if people don't smile, if people don't take care of everyone. You know, it's a self-fulfilling prophecy. So it was just not accepting what often, you know, end up being excuses about what we can be. That hospital in those 10 years went from 32,000 admissions to over 40 in a market that's declining. We got patients from all 50 states and 25 countries of the world. You know, it's how we think that's so important. There are so many limitations if we believe that they are there. So the third thing about our strategy is we do take risk, but not stupid risk. Risk based on the foundational elements of who we are and what we can accomplish. And, you know, it really is, again, it's sort of this belief system. You know, believing in Detroit. I talk about it all the time because, again, I'm an outsider. I came from outside the state, and I thought Detroit was an amazing place. Well, all I heard were the negatives, and people saying no patient will come downtown. I will tell you the best thing that ever happened is when we got our final patient from North Dakota. Yeah, it was our last state we hadn't had a patient from. We were going to have a big marketing campaign in North Dakota to come and have the robotic prostate work that Dr. Money Menon did downtown. But you know, it was pretty cool to tell people, frankly, in Oakland County, who were often the ones that said we can't go downtown, that, well, we're getting patients from Paris, we're getting patients from North Dakota. It's not that hard to come down the lodge and see us. So the cool thing is that once people came down the lodge and saw that it was a clean, beautiful hospital with amazing people, that in fact, life can change. And isn't that what Detroit needs to be? You know, that type of image, that we believe that this is an important jewel in our crown within Southeast Michigan. The other thing that I think is very important, again, is new thinking. I went into healthcare because I thought hospitals were terrible places. When I was growing up, I was a patient in a hospital when I was 5 years old, and my mother was very ill when I was 10, and spent a month in a hospital, 4 children at home, ages 2 to 12. And we never got to visit her. It was atrocious, the lack of sensitivity to what patients really need, the lack of communication, the lack of, you know, amenities for people that are in healthcare. I mean, we all know the problems. So, you know, this hospital, for me, was the most amazing opportunity ever. You know, to build a hospital from scratch and to get it right. You know, we continue to, in all of our facilities, to get it right when it comes to how we treat people and the patient experience from a human standpoint. But it's very hard to design a facility like this when you have an existing infrastructure. So to be able to create something with a different vision, I think, is so exciting. And then, you know, on my tombstone, it's going to read, she's the one who hired the guy from the Ritz to run a new hospital. Kind of a crazy idea, but the truth is it wasn't that crazy and it wasn't that risky. Because I think for those of you who knew Gerard, who now has gone on to even bigger things with the Cancer Centers of America as the CEO there, he was a guy that did have a different view of what healthcare should be. And he was able to execute it based on his vast experience opening hotels around the world, his incredible devotion of his staff. Probably the primary reason I hired Gerard was when I used to go to the Ritz-Carlton with my father, who lives in Dearborn, for dinner. I watched how the staff talked about him. And to me, that was the telling element that we needed in this facility. We needed that type of connection, especially when you're hiring 1,200 people at once. How do you do that and get it right? How do you open a new hospital and get 99 percentile patient satisfaction in the first year? Unheard of stuff. How do you get it right in terms of the health and wellness vision and building things like greenhouses? And creating spaces that really invite the community in. That's different because, again, you do it by thinking differently, wanting to have a different patient-family experience, wanting to have a different role in the community than traditional hospitals have. The other thing we do at Henry Ford very well is diversification. We are not a typical health system. We have the full continuum of care. We have both financing and delivery. We own a health plan, the Health Alliance Plan. We have a physician group that has been with us from the very beginning in 1915, the Henry Ford Medical Group, and we have private physicians. We have academic programs that are both allopathic and osteopathic. We have an incredible teaching and quality environment around really raising everyone up. Because fundamentally, I think my job as a CEO is to create a great environment. At the end of the day, I don't do a lot. I don't take care of patients, I don't pay bills, there's a lot of stuff I don't do. But if we get the environment right and we create that atmosphere, there is no limit to what our people can do. And so I think, from that perspective, it's quite amazing. We have a huge ambulatory network at Henry Ford. We are in every market, and we also really focus on retail. You can tell that here. But we think medicine and healthcare is moving to a retail environment. And that means we have to understand our customers much better. It means we have to be much more connected to them. We are launching this year, we're spending about, in a 3-year period, we're spending about $450 million on IT investment at Henry Ford. That includes the entire health system under a system called Epic. And it also includes our health plan that is launching their next generation of technology as well. And I will tell you that the most important element of the new Epic system, which now is live here at Henry Ford West Bloomfield, is the fact that you have your own chart. I could show you on my phone that I have my medical record on my phone. It's called My Chart, and we are encouraging everyone to stay connected with us because it not only gives you the information you need no matter where you are. You can bring it up and show it to another provider if you're out of state or have something happen. But you can also connect with appointments for your doctor visit. You can get your lab results. The new pressure on our physicians is the fact that oftentimes now the patients have the information before the doctors. That makes them very nervous, I can tell you. I've gotten a few emails on that. But I wrote back and I said, isn't this great? Isn't it great that the patients have the information they need? Now that just means we have to be better. We have to be ahead of them, hopefully. But even if we're not, we can have that conversation. We can connect differently. They could send you an email and say, I need to understand this, and we can connect back. So it's really an exciting time as we try to focus on all elements, I think, of healthcare. The other thing that I think is so important in our strategy is collaboration. It's interesting that we describe this in our Baldrige journey as one of our core competencies, and it is for Henry Ford. You could go way back in history, and you would see a level of collaboration that I think is different than the norm in our industry. And clearly, from the standpoint of our health plan, that was actually a result of collaboration with the UAW. We've had joint ventures over the years that ultimately led to acquisitions. We joint ventured with the Mercy Health System that owned St. Joseph Hospital in Clinton Township for about 15 years before they joined us. So collaboration has been an important part of what we do. The interesting thing is I believe in collaborating with competitors. And I will tell you that that is not also readily understood. But if you think about it, working with other health systems around a whole host of common interests around community, around access to care, around improving quality, around reducing, for example, infant mortality. These are the areas that we have really reached out to our competitors and said, let's work together. And it has made an enormous difference. You know, we have been successful in advocacy because we collaborate. All of our government relations people within Wayne County and beyond work together on a lot of these initiatives. And we work with our Michigan Hospital Association as well, but frankly, if we weren't working around the interests of Southeast Michigan, we could be an outlier in this state, really not getting some of the resources that we need to address the needs of our community. Well, let me talk for a few minutes about leadership, because I think, you know, clearly strategy is very important, but, you know, at Henry Ford, our people, our leadership, and all of our people really are our competitive advantage. Because we're in the people business. You know, that's what we do. You know, we take care of people. And at all levels, we have leadership. We give a lot of awards at Henry Ford. We give Shadow of the Leader Awards every year. But we also give the Shadow of Influence Awards, because people who don't have leadership titles are also leaders. And we want to recognize the people that kind of step out from their comfort zone and help others around them work more effectively. And make sure that, you know, people understand that everyone can be in leadership. Because we influence our patients. A nurse is a leader, influencing the patient in making sure that they understand how to take care of themselves when they leave the hospital. Physicians are all leaders, because the whole team watches their behavior, watches what they do. You know, I kid about the fact that years ago I used to go through the cafeteria line and I'd watch what the cardiologist would eat. Usually it wasn't that good. I thought they were actually recruiting business. But the truth is, we watch each other. You know, we're all under the spotlight, and it's very important what we do. We have incredible people that have passion, they have strategic thinking, they have an incredible capacity to do work. You know, I've tested that a few times over the years. There was one year we built this hospital, and we acquired 2 others in our spare time. We had another year where we were engaged in our merger discussions. We also did corporate restructuring and did our entire new Epic system across the health system. So, you know, it's amazing what people can do if they are inspired by the work and they think it's the right work. And it's like the Olympic athletes. You know, you think that those Olympic records can't possibly be broken again, but they are. And I think when, again, it's all about that inspiration and really working to do things that are important. And you know, our people are not afraid to lead. They lead all over the place. They lead locally, they lead nationally, they lead at the state level. And frankly, I think we lead in a way that, not that we don't respect our competitors, but we kind of ignore them. Because if you're in leadership, you can't be following, you have to be leading. And that means you have to push the envelope, you have to constantly push your thinking. And actually, I also believe that sometimes people that pay too much attention to their competitors, that's time and effort and energy taken away from what you can be doing yourselves to focus on your own business. So whenever anybody comes to me and says, oh, you know what so-and-so is doing? And I said, I don't really care. You know, it's not going to necessarily change the vision we have for what healthcare needs to be doing. And frankly, if we study it, you know, it takes us away. Now, we do like to study people who are ahead of us. We like to study businesses that are not healthcare. And I think we can learn a lot from areas outside of our normal scope in terms of what we do. The culture issue is very interesting because despite an environment that we have had for many years around innovation and leading and doing things differently, when I came to Henry Ford 15 years ago, the culture was described to me as 1,000 points of veto. Great, huh? That really moves you forward, you know? At that time, we were caught. We were caught in some tough economic times. We were caught in a kind of an atmosphere of a lot of excuses and a lot of blaming. And, you know, the truth is that doesn't take you anywhere. So a lot of the work we did back and now going 10 plus years was about really examining our behaviors as leaders. really looking at what we were doing, how we were setting the example, the shadow of the leader that we were creating, the be here now culture, paying attention to each person and their needs and how we support one another. So, the kind of logo we had for many years, we're Henry Ford, we can. The reason we adopted that is that it was aspirational. We wanted to be that kind of an organization. At that time, it could have been we're Henry Ford, we can't. But that didn't sound too good to the marketing folks. But I think that was very important in reshaping our culture to be a can-do culture and to going after things and believing that we could do it. The other thing is my belief that we have to take care of the people who take care of people. We have closed 3 hospitals in the last 12 years at Henry Ford Health System. Despite our growth, we've made some very tough decisions. And in doing that, we've gotten better at taking care of the people who were affected by those changes. And we closed Cottage Hospital in Grosse Pointe a few years ago and are now converting it to a wonderful new site for senior housing and senior services. But when we closed, we actually preserved all the jobs for the people that were affected, 300 people. Last year, we had to close the Warren campus, formerly Bi-County Hospital. And in doing that, we had 700 people that were affected, and we found jobs for all of them. Creating that environment, doing the planning, having the entire system help us as jobs opened up to make sure we got people in so that those jobs were there for them. Listening to our people, solving problems, visibility as a leader, all incredibly important. One of my favorite things I do is I go to the cafeteria wherever I am and I sit down with people I don't know and have lunch with them. And I will tell you, I never have had a bad experience. Other than one time, I was at Henry Ford Hospital, I sat down with a group of laboratory people for breakfast. They stopped eating. I was a little worried about that. So the next time I came back, I saw the same group and I sat with a different group. They said, "Why didn't you sit with us?" I said, "Because you weren't eating. You have to eat." And, but anyway, you get my drift. Part of that culture is about innovation, finding a way to do things even when it seems impossible. And frankly, the most important word in all of our vocabulary is yes. How many times have you gone to a boss with a great idea and they said, "No, not now, no"? Ever had that experience? We all have. That's not the way you create an innovation culture. Even if the idea makes no sense, being open to it, exploring it, seeing if there's merit, seeing how it might fit maybe in a different way, very, very important. And creating a safe culture for people. In healthcare, one of the biggest risks we have is not knowing about problems. Frank mentioned the issue in the cockpit when people don't speak up. Well, let me tell you, in surgery, it's the same life-threatening situation often. If people don't speak up, if they can't come forward. So it's very important. That's why yes is an important word too, because you have to have people that can come forward, tell you what's going on, and then have an ability to deal with it. I think, clearly communication is always something that you never do enough of, and I believe communication is a strategic priority. It has to be planned, it has to be intentional. One of the things I love, my favorite meeting every month, don't tell anyone else, but is my meeting with the communications team. Because we talk about, what can we do to improve the messaging? Our huddles that we have, all the things we're doing, how can we make it better? And I do vodcasts periodically to tell people basically what's going on, different topics. Now, my latest thing is I'm going to have an Oprah-like show. And you guys are hearing it first. The first one was recorded this week, and we're doing, interviews with people around the health system. How fun. So you got to mix it up. You got to do different things. You got to make it attractive for people actually to listen, and so very, very important. So I'm going to end just by telling you a little bit about my thinking about our region and how we can do better. Because it is very clear to me, when I came here 15 years ago, there were a number of things that surprised me about Southeast Michigan. One was little appreciation for the value of healthcare in this market, which kind of sounds a little odd, because people in Michigan probably always knew they had good healthcare. But healthcare was not viewed as an asset in the state. And when you think about good business, you have to have good health care. People won't move to a state if you don't have great health care. And we are fortunate in this state to have amazing health care. Our quality rankings, if you look statewide, are among the highest in the country. I think we're like number 7 or 8. But that's not widely known. So that surprised me. There was little interest at that time, I think it's changed now, in creating a more diverse economy. You know, recognizing that we had to reach out, we had to honor small businesses, we had to honor people in different sectors of the economy. We had to hold them up. It wasn't just about auto anymore. So that was a very important feature. No interest in focusing on Detroit as a region. I will tell you, I spent 8 years in Columbus, Ohio. The only reason Columbus, Ohio is as strong as it is the regional way that they looked at the city and its growth. We have to do that here. You know, we used to think it could be a donut. Detroit could be, you know, just going down the tubes and the donut, it would all work. It doesn't work. Because you know why it doesn't work? Young people today want to be in the urban core. We are not going to attract the talent to this state if we don't have strong urban cores throughout the state. You know, Traverse City is doing very well because it has the feel of a city. Grand Rapids is doing very well because of what they've done in their downtown core. The same has to happen here. And so I'm a big, big champion, as I think all of you know, to embracing the great strengths we have in Detroit and holding it up as a region so that all the things fit together in a much more positive way. And frankly, you know, there was a lack of pride in many ways in this community. And clearly we've taken our shots. But you know, if the cheerleaders aren't from here, how do you possibly expect others to be cheerleaders? And having lived in 9 states in my life, I have some perspective on this. And one of my favorite things I say often is the fact that, you know, this is the best place I've ever lived. It is a beautiful region, beautiful state, beautiful city. And I love it here. But one of the things I love the most is that this area has winning sports teams. And I lived in Ohio for 35 years. I cannot tell you, except for the Ohio State Buckeyes, you know, there aren't many winning sports teams. It's a real challenge, and we take it for granted here. I think it's fabulous. I mean, I can't figure out what to watch anymore. There's so many great, you know, games and things going on. So I'm going to close, and I'll really look forward to your questions, but thank you for your support of our organization. Thanks for the partnership with the Chamber. Thanks for the leadership that you're providing in our community. It just is making a big difference. Thank you.
I don't know if this mic is, there we go. Thank you so much. Well, it's time for questions and answers. If anybody has any questions, if you can pass them this way in your table, I'll come around and grab them in 1 second. So we're going to start with one that actually I love in particular because it highlights one of the things that I really find true and that I enjoy about Henry Ford. I can give my perspective, but I actually want to hear Nancy's perspective. Is it the role of the leader to provide motivation or to remove obstacles so that others are motivated and can excel on their own?
Yes.
Okay, there you go. Next.
No, I think it's both. You know, there's no question that, you know, we talk a lot about it at Henry Ford in leadership development kind of forums. But, you know, if the leader isn't enthusiastic, you know, it's hard for others to be enthusiastic. You know, you create that sense of energy by your own behavior. So I think, you know, it's clear you have to try to motivate and inspire. But frankly, you have to remove a lot of obstacles. You have to be a problem solver. But, you know, the truth is most teams can problem solve very effectively. They can, you know, sometimes it's just pushing it back and knowing that you're there to help support them that really makes a big difference. This thing seems to be coming off and on. Is it? Yeah, I'll hold it a little closer. Okay, Frank.
Okay, sorry. This one is a very broad question with the next one. What do you think will be the impact of Obamacare on health care, and or do you think the cost of health care will go down with current reform strategies?
Well, you know, as I said before, we are in a period of the most dramatic change ever in our industry. And to some degree, you know, we don't know the answer to that. We have to shape, I think, how this new legislation and all of its facets, because it's incredibly complicated, we have to shape it to make it what it needs to be. And we also have to help improve it. Because, you know, there is no piece of legislation of this magnitude that has it right all the first time. It just won't. And there are already things that are starting to come out that we know are going to be challenging. But, you know, one of the things I'm most proud of in the state of Michigan, and I had the chance to see our governor a couple times in the last week, is that this state moved forward on the Medicaid expansion. Because that truly was the most important aspect of the legislation. That, you know, for all of us who are very fortunate to have health care coverage, when we get sick, we don't have that as the worry. But, you know, we know for many of our patients in the Henry Ford Health System, they don't have that. And, you know, think about the anxiety of getting a cancer diagnosis and having no coverage. And it happens every day. So we are very pleased that the state, in a bipartisan fashion, put that legislation through, and I think we have a chance to really make a difference. But, you know, to answer your question, there are a lot of things that can positively impact cost. You know, part of it is our own, you know, when we have more responsibility for cost, and all of the exchange products, most of them, including Medicaid expansion, have some cost sharing. And I think that helps us make some choices that hopefully will be economical, but hopefully good choices in terms of managing our care. In addition, I think, you know, the other aspect is that, you know, for years we have been shifting cost to business because Medicare and Medicaid typically didn't cover the full cost of care. Now that we have some improvement on that with the expansion, the hope is we can moderate, you know, that shifting and moderate overall the cost. And clearly, if patients have coverage versus going to the ER for care, there's a big cost difference between going to a physician, getting the screenings and routine checkups that they need, and hopefully managing chronic disease in a much more effective way than showing up in the ED when you're already very sick and then have a complex problem that is very costly. So I don't think we're going to know completely, but certainly what we're doing is moving us in the right direction.
Excellent, thank you. There are, I guess, sort of the elephant in the room questions here, several of them in sequence. Let's see, we'll start with what happened with the merger between Henry Ford and Beaumont Hospital. Are there other merger discussions for Henry Ford? Are there any plans to partner with any other health systems, et cetera, et cetera? There's a few here.
So merger is the topic? Okay,
yes.
I got it. You know, we were we really appreciated the opportunity to have the merger discussions. They took about a year because we have great respect for Beaumont Health System. And, you know, our hope was that we could come out of it with, you know, the right plan. But, you know, when you go through that process, you realize there are differences. We knew before we started that there were differences, you know, in the two organizations. You know, our histories, our traditions, our cultures were different. So at the end of the day, that became a differentiator for us. It became something we could not overcome. But, you know, we never say never. You know, who knows, in a few years we might be back talking about that same opportunity with Beaumont. You just don't know. But I also think that, you know, there will be a lot of change in our marketplace. Detroit is considered one of the least consolidated marketplaces in healthcare. You know, if you look at Pittsburgh, that basically has, you know, 2 health systems. Philadelphia might have 2 major and a couple minor. We are a very large, you know, market that has a ton of different health systems. So I would expect over the next 5 years we will see some consolidation. And, you know, we'll probably, frankly, see some more closures. Because, you know, as people pay more of the cost of care and we're more effective in keeping people out of the hospital, you know, we may not need as many hospitals as we have today. So I think there will be a lot of change, but we're always open to those. You know, as I said, we think collaboration is great. We've had many different types of strategic partnerships over time, and we'll continue to keep our options open.
Okay, this one is pertinent to the West Bloomfield community specifically. When will Henry Ford West Bloomfield announce its new CEO, or what is the progress in the CEO search for it?
Great. No, I appreciate that question. You know, as I think all of you know, we were, you know, obviously sad to see Gerard go. He brought a very unique, not only vision, but personality to our organization. And I miss those kisses, you know. It's, I always said to him, he kissed more women than anyone I know because he figured out you could do it 3 times. I never had heard of that. I didn't even know that was a cultural norm anywhere, but apparently for Gerard it was. But in any event, you know, the great thing about our team is, you know, we've got tremendous leadership here today that, you know, was part of the team that Gerard put together. You know, our folks are doing a magnificent job. I said, you know, we launched without Gerard the whole Epic system here, and they have just done extraordinary work. So kudos. I see a few members of that team right here, and things are continuing to move along beautifully. But we have had a very active search process for his successor. We've received over 100 inquiries. We have a great team of leaders, both board leaders and physician and administrative leaders, part of that search committee. We're down to kind of the final few, and they will be going through their paces. You know, we don't hire people easily. It takes a while, you know, and I actually think that's a great thing because you need to see people in different settings with different groups, you know, really understand what you're getting, because as we all know, we've all made hiring mistakes, and, you know, we want to make sure we get this right. But I would expect certainly, you know, before the end of the year, we will have that announcement.
Now, just, I guess my own personal curiosity would agree, is it somebody that is going to, or are you looking for someone that is going to maintain the vision or bring a different vision?
Well, you know, the vision here is the vision of the Henry Ford Health System. So we certainly want someone who is going to be involved in transforming lives and communities through health and wellness, one person at a time. That's our vision. So we don't want someone that, you know, is going to disrupt that. But, you know, every leader brings their own talents and experience. And I also have a belief that organizations, you know, go through different periods where they need different skills and talents. You know, one of the reasons I hired Gerard was he had had great experience in opening something, you know, this complicated, in creating that vision. But, you know, for the future, we may need some different skills to, you know, continue the growth curve, you know, make sure that we're reaching out very effectively to our physicians and to the community at large. So I think, you know, everybody's a little bit unique, but we certainly are not looking for anyone that's not fully committed to the vision.
What projects are next, expansion or other areas of interest for the Henry Ford Health System?
Well, you know, we've always got a laundry list of a lot of things underway. And, you know, it's interesting to me that people, you know, some of our competitors go out there and they talk about all their investments. Well, people, as I told you today, we're investing $450 million in our IT systems because we think that having the right information and having it completely available across the entire system is very important to the patient experience. It's important to quality and patient safety. It's important to our team so that wherever they go, they're using the same tools. So this is a huge investment for us, and we will complete that in about a year. So we are in a 3-year kind of glide path here where we are, you know, going to have the full spectrum of IT systems available. Henry Ford Hospital downtown will be going live on November 1st, and next year we do Wyandotte and Macomb. We've already done the medical group, all the ambulatory sites, so we're well on our way. But subsequent to that, you know, we want to see a little of the dust settle, frankly, with healthcare reform, to really evaluate some of the things that we had planned to do. You know, inpatient expansion in particular, we are going to be a little bit careful about because of all the changes that we're experiencing. You know, more minimally invasive surgery available. A lot of things are moving out of the hospital, so we need to make sure we're investing properly. But one thing we do want to do is continue to develop this campus. We want to develop our Macomb campus. We want to develop our downtown campus. We want to continue to develop, you know, the kind of the wellness orientation of all of the sites within the Henry Ford Health System. But we have 300 acres south of the Boulevard, downtown Detroit, that we are working to develop, and in fact are starting with Cardinal Health Distribution Center, which will be launching their construction within the next few weeks. And, you know, part of what we are looking at there is how do we take, you know, the things we have done traditionally on that campus and make them much more user-friendly, you know, more ambulatory focused, take advantage of some of the centers of excellence of the health system to create kind of the models for the future. So a lot of cool things on our plate.
Exciting. It'll be the Henry Ford Village.
That's right. Exactly.
New center. Actually, something specific to West Bloomfield. When are you planning on expanding or using the back 80 acres?
Well, that's the vision. Actually, before Gerard left, he was beginning to work on, some ideas for how this, 80 acres and really the 160 acres can be very effective. One of the things we're most excited about, frankly, is the vision we have in behavioral health, which I didn't mention, but is very important. Dr. Ed Coffey and his team have created what's called perfect depression care, which is basically providing a level of service to patients who are depressed to absolutely eliminate suicide. And the work that he's done has been nationally recognized and has created a real vision for how we need to change the environment for behavioral health and really integrate behavioral health as mainstream care into all that we do. And so we're envisioning for the 160 acres a brand new Maple Grove 2, which we think will be very exciting, that really focuses on those dimensions. We also want to have other spaces here, again, that are very patient, family-oriented, very accessible, kind of the laboratory of new models of care. And we don't know all of them yet, but we're certainly starting to look at the site and figure out where we might put things as they evolve.
A couple of personal questions, actually. What is the most challenging part of your job?
That's a good question, because I don't really look at it that way. I love what I do. I've always thought I had the best job in healthcare, and I, every day is interesting. When I was a kid, I hated to be bored. Well, I think I chose the right profession. I think probably I would have said before Medicaid got approved that was very challenging. I was quite concerned about whether we would be able to have access for people in Michigan that really need it. But I'm feeling very encouraged now. And I also, it's usually the things I can't control, the things they do to us in Washington that probably are the greatest challenges. That's why I spend a lot of time there to try to help influence or at least share real life practical stories about how their work impacts people. And I think when we do that, we end up with a lot of effectiveness. When we don't do that, we can really miss the boat. They're kind of in a bubble there, so it's important that we break the bubble and help them see what's going on.
World. What is your advice for other women who want to move to the top of their field?
Well, this is what I tell my kids. Probably the most important thing, I think, is seizing opportunity. Sometimes it's not when it's planned, and that's difficult, especially if you're balancing family and work. But it does make a difference, so you kind of have to seize the moments and take advantage of those opportunities. I've always felt that, work ethic and attitude are everything. I really believe that it's not always the smartest person that gets the chances in life to do amazing things. It's often the person that's out there just slugging it away, never giving up, and is able to rebound even from disappointment. And everybody's had it. So I think those are the things that really stand out. I also tell women who want to be CEOs that make sure you have the grounding in the financial side. In my career, it was very important that I have an MBA, but I concentrated not only in healthcare leadership and administration, but also in accounting. And I took all the advanced accounting classes because I wanted to be able to talk to our CFO and have a working knowledge. I wanted to be able to talk with boards, and when I started my career, they were largely men. And so I wanted to be able to hold my own as a woman on kind of the hard science of leadership as well as the soft. And that's proven, I think, to be very helpful.
Somebody wants to know, living in the area, are there opportunities to volunteer at Henry Ford West Bloomfield, and how people can become more involved in the hospital itself?
Yeah, I was just going to say, would you like to speak? Here, I'll give you my mic. Here, there you go.
The question was, how do people get involved in volunteering here at Henry Ford West Bloomfield? Well, on our Henry Ford West Bloomfield website, at the bottom of the page is a blue banner, and in that blue banner it says volunteering. And if you click on that, you can submit a prospective volunteer information form. Or if you want live and in person, you can see me today before I leave, and I'd be happy to talk with you.
Thank you. And her name is Linda Smith. Yes. And she will wait around for all the volunteers that are gonna come up.
Actually, to me, I think what's the number one recommendation for a healthy lifestyle? Actually, Nancy and I had been talking about this. It's actually moderation. That's my number one recommendation. If you look at your life and you do anything in excess, cut back, or at least review it and consider whether maybe it would be appropriate to cut back a little bit. Are there any more questions from anybody in the audience? Anything else that Nancy can answer for you? Okay,
well, thank you so much. Really,
thank you
it's been a pleasure
so much.
being here.
So what I'd like to do now is thank a few people. Obviously, I want to thank Nancy for all of her terrific insight into the Henry Ford Health System and leadership. But I also want to thank American House, who is one of our sponsors. Clap, round of applause, please. I want to thank Comcast Business Services as well. And obviously Henry Ford West Bloomfield, our wonderful host. And we have a very special tour of the greenhouses that will start at 2 o'clock for those that want to take advantage of an opportunity to really see how hospital food can be transformative and how Henry Ford West Bloomfield has transformed all the food that you've eaten into something that is edible and delicious. So thank you so much. Please sign up or please see someone about the greenhouse tours at 2 o'clock. But it's been my pleasure to be here. I really appreciate all of your attention and have a nice afternoon.